Arizona will receive $3.5 million from the Centers for Disease Control to help prevent drug use and overdoses from prescription pain medications. Cronkite News analyzed emergency room admissions across the state and found nearly 12,000 drug users OD'd between 2009 and 2013. Cronkite News reporter Jesse Schultz joins us with an in-depth look at the data. Jesse?
Earlier this year, Cronkite News documented the epidemic of heroin use in Arizona, an addiction that often starts with the misuse of prescription pills and other drugs. Officials hope that this money from the CDC will pay for new ways to fight this growing problem.
But, you know, if a doctor just sends you out of the hospital or his office with 60 Percocets, an addict's just going to take them constantly until they're gone, and then now they're really hooked.
For those addicted to prescription drugs, overdoses and relapses are just a normal part of life. Cronkite News found that from 2009 to 2013, almost 12,000 drug users were taken to Arizona emergency rooms because of drug overdoses involving prescription drugs, heroin, and methadone. While not all of those are fatal, the number is alarming. Banner Poison and Drug Center Information Outreach Specialist Maureen Rowland said that many of the calls to their helpline are about drugs.
A lot of the calls we get are kind of accidental misuse of opioids, and then we do get the overdoses too, and those are intentional or unintentional overdoses.
And some of those problems begin with doctor prescriptions.
We do see that people are being prescribed it younger and younger, and often unnecessarily.
The CDC recognized the growing epidemic, and Arizona was one of 16 states chosen to receive money to tackle prescription drug misuse. The money will be handled by the Arizona Department of Health Services. The DEA's special agent in charge, Douglas Coleman, said money like this is needed for education.
Kids are going to get what they can get, so we have to educate everybody about what the problems are.
The Arizona Department of Health Services did not return our calls to tell us where the money would be specifically used. In the broadcast center, Jesse Schultz, Cronkite News.